California Medicine Scholars Program is a community college to medical school pathway program focusing on diversifying the physician workforce while addressing the physician shortage in California. This pathway is an opportunity for regions to work in a collaborative way that allows true hand-holding for these students.
As part of the MD4CA campaign is working in coalition. We are not looking to reinvent the wheel, we're working in partnership with folks who are already advancing the work. CMSP is an amazing example of that. They are leading powerful work to connect community colleges into the physician pathway and ensuring that Latine and structurally disenfranchised communities are having access to opportunities to ensure that they can make it successfully to med school.
In the Central Valley, we have a large lack of physicians, so it's very hard to get shadowing opportunities, internship opportunities, and CMSP has opened some of those doors.
What we know is that oftentimes our community college students who are our communities of color, it's where our Latinos and our Black students are beginning, that we need to start those pathways earlier.
I am so proud to be here and to be supporting our youth to ensure that they have access not only to these career pathways, but also access to us, legislators. They need to know that we care and that we're here to support them.
I believe there's a lack in representation, especially in the Latino population, and CMSP's goal is to create a pipeline from community college students, especially those who come from underprivileged backgrounds.
A lot of doctors that come in and then they'll leave because they're not from the area. Establishing this program was so important because the talent is in those communities across all state in every community. But if you don't invest in it and those communities that are underserved, then the talent can't come to fruition and become the doctors that the community deserves.
I hope to be able to serve the community that I'm from and to be able to use my Spanish to help treat patients and make them feel understood and heard.
These students are so passionate about what they do. So many of these students have been wanting to be doctors since they were kids. It's not always this field that you explore and find out later on. The passion starts at such a young age because of the experiences they have.
The Latino physician shortage is very concerning. In California, Latinos make up 40% of the population, and yet we only make up 6% of the physician workforce.
When we're talking about students in medicine, that's also students who maybe they become nurses, maybe they become community health workers, maybe they become EMTs. It's looking at this population at a greater scale.
This is incredibly important for our communities. Not only am I a Latina, but I was a second language learner and grew up very, very disadvantaged. And I think that if I had had programs like this for myself, I think it would have opened doors a lot sooner.
When we have a disproportionate amount of Latino doctors compared to patients, there is disconnect on all levels.
When Latino patients show up at the doctor's office, at a clinic, they need to see a doctor that looks like them, that can understand their work, their life, the way that they interact with the world on a day-to-day basis.
This is a sustainable model. Starting from the beginning at community colleges, knowing who those students are, having them reflect the community, and having that long-term support system for these students, making sure that they know that they are supported by the state, that they matter to the state, that they have ample opportunity just like anybody else, that this long-term model can go on and continue to produce more doctors. This is such an opportunity for our students to shine, and even a glimpse of that opportunity and having a program like this that allows them to have that opportunity will change their lives long term.